Welcome colleagues, welcome to this joint webinar between Ofsted and the Care Quality Commission. I'm Lisa Pascoe, I'm the Deputy Director with responsibility for regulation and social care policy here at Ofsted, and I'm joined by my colleague Lucy.
Hi everyone, I'm Lucy Hart from the Care Quality Commission and I'm Deputy Director of Multi-Agency Operations.
So, welcome to today's webinar. It's great to have you here. Lovely to have thumbs up. Thank you colleagues, great to see. Both regulators are working really closely together. We've worked together closely on a lot of projects over the years. We have joint inspections in different places. But over the last year, we've really brought together our regulatory functions in a very different way. So we've always had joint registration guidance that was published on our website. But I think, Lucy, me and you were quite honest when we went back to that. We thought it was quite complicated to understand. It wasn't easy for people, and we came across examples of people not understanding that in practice. So we revisited the guidance to make it much simpler, we hope. Well, as simple as it can be, because some of this isn't simple, some of it is quite complicated. So this webinar today is a chance to go through that guidance in some more detail with myself and Lucy, but nothing in there is new. Our regulatory functions haven't changed and the legislation that underpins what we do hasn't changed. So a few things about the webinar before we get started. You can put questions in the side, so please do that. Please do your best, pop things in there, and if we can answer them, we will. Lots of you sent in questions in advance, which was brilliant because that means we've constructed the webinar around the things that you've already asked us. So hopefully you will see things that in there that answer your questions as we go. It will be recorded. It will be available on the YouTube channel afterwards. So if there is anything you want to go back to, you can do, or if there are colleagues who want to catch up at a later date, they'll be able to do so. Yes, you'll have access to the slides, so you will be able to access those later. But just to be clear what today won't be, we won't be able to answer individual questions. So I'm conscious we'll have people here who are CQC providers, we'll have people here who are Ofsted providers, and I know we have some commissioners here. We'll be talking in very general terms. So if you've got very specific examples, unfortunately, they aren't the sort of thing we can pick up today, but we will be able to pick up with you at a later date. Similarly, if there are questions that you ask and we don't get time to get to them today, they'll help inform how we update the guidance going forward. Or similarly, again, if there's any communications we feel we need to send out, we'll take that opportunity to do so. We're going to go off camera. Helps with bandwidth, hopefully means nothing goes wrong. We'll come back on at the end when there's some time for questions, but for now we're going to disappear, let you look at the slides, but we'll carry on working through the information with you. So we'll just turn our cameras off. So this is what we hope to cover today. Some of it you'll know, some of it you might be really familiar with, but we will do some of the basics just so that we build any learning that we share with you today on a shared understanding. We'll go through some key definitions. We'll talk about how you work out which of us to register with and what are the occasions when you may need to register with both of us. Also give you some information what the different registration means. Ofsted and CQC are quite different in terms of the functions we've been asked to perform and how we've been asked to perform them by government. So that does lead to some differences in our approach. So it's a good opportunity for us to talk those through with you. And then there's a bit of a forward look at how we're continuing to work together to get things right for children. So let's go on to understanding some of those basics. It is really important that people are registered with the right regulator. The regulatory regimes that have been set up are there for good reason. And nobody wants to be operating illegally, and none of us want children to be in settings that don't have the right level of oversight from the right regulator. But we know this isn't straightforward, hence the guidance, hence the opportunity today, and hence our ongoing engagement with you. And there will always be services that is sometimes not immediately apparent where they need to sit. And that's where we need to help you and give you the best advice about who you should apply to register with. One of the myths we'd like to bust today is this idea of dual registration. Um, People might be registered with both of us, but we both think that calling it dual registration is unhelpful because the registration process is different, the registration requirements are different, and the ongoing regulatory oversight is different. And dual registration tends to imply that there's something quite comparable between the two. It also implies you can apply to one of us and that assists you in applying with the other. Unfortunately, the systems don't work that way. We do, as I say, have different requirements, different legislation that sits around both of what we do. And so, in terms of those different regulatory responsibilities, from an Ofsted point of view, we regulate settings that provide children's social care. And Lucy, from your point of view?
Thanks, Lisa. Yeah. So I think just to reiterate as well that what we are inspecting and regulating hasn't changed. We hope that the guidance is more clear about that. But for clarity on this call, CQC regulates the health and social care activities, and we call those the regulated activities. So there are a number of acronyms that always kind of crop up when we talk about those regulated activities, and we will refer to CQC's scope of registration document as our statutory guidance throughout this webinar. I'm going to talk a little bit now to unpick those different aspects of what that activity looks like in some of these settings. So I've already said that CQC regulates the health and social care activities. We focus on the services that are provided into that setting. So we register and regulate most types of healthcare for children. And we also register and regulate adult care homes and home care agencies, some of which may provide services to children. I think this slide also serves to highlight that our service providers can be an individual, it can be a partnership or an organisation. So there is a number of different service types that you all may be familiar with that would register with CQC to provide those services to children. And some of those regulated activities that we'll talk a little bit more about as we go through this webinar. Some of the regulated activities that you might be more familiar with are things like TDDI, which stands for Treatment of Disease, Disorder and Injury. That is a common regulated activity that we see applications for registration with CQC that are provided into by children's homes. Over to you, Lisa.
So from an Ofsted perspective, and we're mainly talking about children's homes today, we actually regulate and inspect the setting, so the individual children's home, and we regulate the care and accommodation that happens for children at that setting. And we're very much focused on the outcomes for children within that service. And so from our inspection point of view, we have our social care common inspection framework, where we would look at the progress and experiences of children within that children's home. And just for further clarity, you can see there's a list there of all the other children's social care services that Ofsted regulates and inspects, most of which probably aren't as relevant to this webinar, but I would draw people's attention to the fact that Ofsted now regulates and inspects supported accommodation, and we will come back to that later. So good time to go on to key definitions. And just to be really clear what a children's home is, really important one for people to understand this. A children's home is a setting that provides care and accommodation wholly or mainly for children. And we call this the wholly or mainly principle. And this is designed so that children do not have to move out of a children's home the minute they reach their 18th birthday. That is the purpose of this. For some children, it is and will be appropriate that they stay there beyond their 18th birthday. Obviously, we expect good transitional planning and that people are thinking about their forever home or their next steps or whatever that may be. But there is no line in the sand that says that the minute a child turns 18, they must move out. But what the law does say is that a children's home is somewhere that is wholly or mainly for children. So there is a tipping point. So young adults aged 18 or over, as I say, must be in the minority. It must be that the primary purpose of that home is for children under the age of 18. We take a quite pragmatic and sensible view of that, looking over time. We know that, particularly as children's homes have become smaller, if you only have, two children in a home, one child becomes over 18, the other child is 16. We need to work through that pragmatically with you, but the principle is wholly or mainly. And there is the contra to that, Lucy, isn't there, from your perspective?
Yeah, yeah, absolutely. So that would be those, thinking back to the previous slide and thinking about our adult social care residential settings. And there's some of the settings and providers that Ofsted and CQC are continuing to work together on. Yeah.
So I just mentioned on the couple of slides ago, didn't I, about supported accommodation. So Ofsted started regulating supported accommodation last year. Supported accommodation has a very specific definition. It is about, and it's here on the slide for you, but I will read it out because it is a really important, because it is very specific. It is a home where looked after children and care leavers aged 16 or 17 live and receive support from staff who may or may not stay at the setting. And those providers can be registered with Ofsted to provide supported accommodation at a number of specified addresses. And there are different types of supported accommodation. Some of it is single occupancy flats. Some of it is supported lodgings where children are living with families or other adults. And some of it is shared occupancy buildings, which might be ring fenced for children and care leavers aged 16 or 17, or may be shared with children who may previously have been homeless, or with young adults or other adults. This differs from supported living, Lucy.
Thanks, Lisa. Thanks. And I'll do the same. I'll just read out that definition on the slide because I think it's really important for us to be clear about the difference between supported accommodation and supported living. So supported living is services that often provide personal care to adults as part of the support that they need to live in their own homes. Supported living is not currently a regulated activity, but supported living providers that do not provide the regulated activity of personal care are not required by law to register with CQC. But sometimes what that means in terms of CQC's responsibility is sometimes CQC will be regulating the regulated activity that is provided in that supported living service. But so I think our key point for this slide is that thinking about supported living that CQC regulates is for adults who are 18 years and over. If children are receiving a CQC regulated activity, so for example, TDDI, which is treatment of disease, disorder and injury, or have personal care needs, then it's more than likely that an Ofsted regulated children's home would be the appropriate setting rather than a supported living environment. So I think that feels quite clear that that should be that would be something that we would be thinking about, that would be jointly registered rather than it being a supported living scenario. And that children often, and we will talk about this as we go through the slides, don't fall into CQC's regulated activity of personal care unless they are receiving that care from a domiciliary care agency, which they often can do. But I'll talk a little bit more as we go through the webinar about that definition of personal care.
And just before we go to the next slide, Lucy, I just saw a couple of questions popping up in the sidebar about children in supported accommodation who require care. So Ofsted's position on that, if those children are under the age of 18 and they actually require care, then it is quite likely that the appropriate placement for them is a children's home or obviously, of course, a foster carer. In supported accommodation, the intent should be that this is a young person of 16 or 17 who is ready to live in that type of environment with support. We know that children may have a crisis, and we absolutely would expect a supported accommodation provider to do what they can to manage that crisis, to support that young person in all the ways that you would expect. But the intention of that placement should be about a child who is ready for that level of independence. Sorry, Lucy, I could just see questions coming
Yeah.
in on that, so it seemed a good time to
Yeah.
answer.
No. Thanks, Lisa. Thank you. I'm just going to talk us through the some of those key definitions that we've already started to allude to as we've gone through the first slides of the webinar. So this is thinking about those regulated activities that bring providers into scope of registration and regulation with CQC. So a regulated activity is an activity involving or connected with the provision of health or social care. And that's those powers given to CQC under the Health and Social Care Act 2008. Children's services regulated activities will often include the treatment of disease, disorder and injury, or personal care. So we're particularly highlighting those two regulated activities because they are quite often the regulated activities that that Ofsted and CQC are in discussion about when we are registering providers who either register with us both, or it's not clear who they would register with. The treatment of disease, disorder and injury, which is often shortened to TDDI, is the provision of treatment by or under the supervision of a defined list of healthcare professionals or by that multi-agency team for treatment of a disease, disorder or injury. It is a legally defined regulated activity, so we've not got scope to make adjustments to that at the point that you are making applications to register with CQC. But like I said, one of the most commonly regulated activities that we see in children's homes are TDDI. So it's important to talk about that, and we will talk a little bit more about what that can look like at the point of registration in terms of delegation. I'll talk about that a little bit later on in the slides. I think the other thing that we need to highlight as well when we're thinking about TDDI is that defined list of healthcare professionals, because that's really important when we think about where the accountability lies, either when we're thinking about delegation or when we're thinking about whether that activity that's being delivered falls into scope of CQC's regulation. So I'll just talk a little bit more about about another definition that I think we often spend lots of time talking about between Ofsted and CQC and with providers and with commissioners, and that's around personal care. So personal care is a regulated activity that requires registration with, in most cases, requires registration with CQC. But I would also think about the point that Lisa had made earlier, which is that we don't dually register. So we don't dually register and we don't then dually regulate. We can't regulate the same things. So personal care, according to the Care Qualities definition from the Health and Social Care Act, relates to physical assistance given to a person to help with tasks in daily life and prompting and supervising a person to do any of these activities where the person is unable to decide for themselves about performing such an activity without being prompted or supervised. So that does apply when it is provided in the child's family home, for example, by a domiciliary care agency that's registered with CQC. So what CQC don't then do is we don't go and inspect that family home that the child may be living in, but we would inspect the domiciliary care agency that is providing that service to those children. Personal care, the CQC regulated activity of personal care doesn't apply to children living in children's homes that are regulated by Ofsted. And that is again thinking back to that concept that we can't register and regulate the same activity. The full list of personal care tasks is listed in CQC's glossary document. So that's within that scope of registration document. I'll just talk us through briefly during this webinar so that we can, for people who may have any questions about it. But personal care is related to physical assistance that's given to a person in connection with eating or drinking, toileting, washing or bathing, dressing, oral care, care of skin, hair and nails, prompting and supervising a person to do any of those types of personal care that I've just mentioned, where a person is unable to make the decision for themselves about performing that activity without being prompted and supervised, is a CQC regulated activity of personal care in those domiciliary care environments. There is an explanatory note in the CQC scope of registration guidance. I think that there is some challenges in thinking about children and that applying that definition to children, because children often don't need all of that mix of let's call it ingredients that I've just described, and so quite often children will fall outside of CQC's definition of personal care. Things that aren't personal care that are often confused include medicines, cooking, meal preparation, things such as cleaning and domestic tasks like laundry or housework, or setting up and preparing a bath. So I think those talking about what's not personal care might help us when you're thinking about those situations with either as a provider or a commissioner. So I'll just go on and talk a little bit about delegated authority. I think it's important to frame for this webinar that we are talking about delegated authority at the point of registration. So that and we are talking about that at the point of registration with CQC, which is at that point an intent. So we are thinking about how the provider that is registering with CQC intends to delegate any of their regulated activity to, for example, care staff in a children's home. There could be lots of other scenarios, and there's an example on the slides here. I'll just read out the slides as well for clarity. So a healthcare professional employed by a provider registered with CQC for the regulated activity of TDDI can delegate a procedure to a care worker or nursing associate who is employed by a second provider. And there is the example on the screen. That second provider must not let staff accept those delegated tasks unless they have had enough support, supervision, education and training. So if we think about what that looks like at the point of registration, that will include things like the training that the registered provider will be offering to staff that they would delegate to. It's not, I think it's quite a complex matter. So I think it's really important that we are thinking about this webinar and we're thinking about it at the point of registration rather than when we go through to our inspection activity. So hopefully that's set some of the scene for what can feel like some quite complex sets of scenarios. We will talk about some of the scenarios that people have fielded in terms of questions and try and bring some of these rules to life a little bit towards the end of the presentation. But I'm just going to hand over to Lisa to talk about thinking about who to register with.
Yeah, so let's move on into determining who to register with. So settings which provide care and accommodation wholly or mainly to children must be registered with Ofsted. And by children, we mean children under the age of 18. Other than that provision that is just providing support in the supported accommodation for 16 and 17-year-old children in care and care leavers, as described earlier. There is a YouTube video on Ofsted's YouTube channel, which will give people lots more information about when is supported accommodation the right option. So for colleagues who I could see are really interested in that area, I'd really direct you towards that YouTube video. So the next bit on this slide builds on from, as Lucy was just describing, if a person employed by the provider is delivering TDDI or personal care, as Lucy's just outlined, then that is regulated activity that must be registered with CQC by this provider. And that's the circumstance where a children's home is therefore a children's home registered with Ofsted, but is delivering some activity that is regulated by CQC. And I really appreciate, colleagues, that this sounds really complicated. Some children's homes, quite rightly and understandably, to meet the health needs of children, have people coming in from elsewhere to deliver those health services to those children. That healthcare provider will be regulated by CQC elsewhere. So specialist healthcare support from a GP, the children's home doesn't need to see that as their regulated activity, because that is activity that is regulated elsewhere. So that real difference is about the people being employed by the children's home itself. That's what tips it into the regulated activity with CQC. If it's brought in, it doesn't need to be. So if we just move on to the next slide. So we've got some examples on here, which maybe hopefully start to help this make sense for people. So 17-year-old looked after child living in supported housing. Hopefully people are really clear. That is supported accommodation that should be registered with Ofsted. If the children have high levels of need that require health or social care services, then this is unlikely to be the right sort of service for them. Again, back to that definition of supported accommodation, I really would urge people to go and look at the webinar that we've done around that subject. But supported accommodation is not suitable for children who have high or complex needs, children who are having their liberty restricted, or if they require a high level of ongoing care or supervision, those are children that are not ready for supported accommodation, and anybody delivering a service for those children are likely to require registration as a children's home. And then in terms of the, I think it's yours next, isn't it? It is, yeah.
I'll talk us through the Home A scenario, which is that Home A provides care and accommodation to children under 18. There are several regulated healthcare activities delivered by a healthcare professional employed directly by the home. So that type of scenario at home should be registered with both Ofsted and CQC. That regulated activity would be assessed at the point of regulation. Home A is providing accommodation wholly or mainly to children, so that's where it brings it into scope of it being an Ofsted registered service rather than a CQC registered adult social care home. I think it's important as well to highlight that in this sort of example, that children are likely to have a range of different needs in these sorts of locations. And for you as providers out there, I imagine on this call today, there are providers and commissioners who look to place and provide care for children who do have a range of different needs. So just as an example, that it will include children who are neurodivergent, including children who are autistic and have ADHD. They may be in receipt of that CQC regulated activity, and that would need to be, in order to be registered with both CQC and Ofsted, that regulated activity would need to be delivered by somebody who is employed by the registered location. So if a different provider was going into the home to meet that child's needs, their health needs, then that provider may be registered with CQC. They would be inspected under a different framework. They wouldn't be part of that CQC and Ofsted registration because they're not employed directly by that provider at that home. And again, I would just point you to the CQC scope of registration document to look at the healthcare professionals who provide TDDI and whether that brings it into scope of CQC. And then I'll just talk us through Home B, which Home B opens as an adult's home but has a condition permitting them to provide care and accommodation to children. There are 5 beds in the home and 4 are occupied by children. So we've brought this to life as an example based on some of the questions that people have submitted, but also based on some of the scenarios that Ofsted and CQC are frequently working our way through. So this is likely that this provider originally registered with CQC and has then become a children's home because they're looking after wholly or mainly children. So under Ofsted and CQC's memorandum of understanding, when we are coming across circumstances like this, we are sharing information with each other about the types of care that is being provided and working together to try and unpick the best case scenario for registration. And I think the starting point for that is, as Lisa said at the beginning of this webinar, is about making sure that our regulation is providing the safest and best outcomes for children and young people who are accessing care and support in all of these different scenarios. And I'll hand over to you, Lisa, for the last local authority one.
Yeah, so the last example is a local authority that finds a building, a home, a house, and then employs a domiciliary care agency to provide personal care to the 2 children who live in the home. And we have seen this example, so it felt like a really good one to put forward. So while the domiciliary care agency may be registered and regulated by CQC to provide domiciliary care, the arrangement that has been created is actually a children's home. So it would need to be registered as a children's home. The fact that the domiciliary care agency is regulated by CQC does not absolve that arrangement from requiring registration. And as it stands, it will be operating as an unregistered children's home, and the local authority and the domiciliary care agency are both part of running that unregistered children's home. So if we just go on to the next slide, and I think quite a lot of health examples again on here, Lucy.
Yeah. Thanks, Lisa. So if I start to, I'll talk us through some of these examples that have been provided by you in fielding those questions in advance of the webinar. So thank you. And I think having seen some of the questions that are coming through on the chat as well, I know that there are lots of questions about personal care, and personal care generates lots of questions and it generates lots of discussion. I think before I move through the scenarios as well, I'd just like to reiterate that so that personal care activity that CQC regulate in general is only regulated at the point of where that child lives. So we wouldn't regulate personal care when a child goes and visits a hospice, for example. So it's got to be, so when we're thinking about that DCA, so the domiciliary care agency context, we're thinking about that in the location where the child would live. We're not thinking about it regulating it wherever that child goes. That would become something that would be logistically very difficult to deliver. But I just thought it might be important to set that context before we go through these examples. So I'll walk us through the first example. So we've got a young person with diabetes. Do we need to register with CQC? So whether you would need to register with CQC or not depends on who's delivering that healthcare to meet that child's child's needs. It depends on who they are employed by. So again, I would point you back to our scope of registration document. That would be the best place to go to. But who it is, as in what type of medical professional and who they are employed by, would answer the question as to who would then need to be registered with CQC if anybody does need to be registered with CQC. And of course, you may have care then that is delegated to you by a service that is already registered with CQC. And then the next scenario example that I'll pick up is whether children under 18 can be placed in CQC registered residential homes. CQC, as I'm sure lots of you on the call will know, register residential homes, and providers can add what we call special considerations, and children's can be a special consideration, but we would be really mindful in this scenario in thinking about whether that provider can meet children's needs, B, whether they then become a children's home. So are they then wholly or mainly looking after children? And then it's not a service then that should be registered with CQC, because that doesn't provide the best outcomes for children and young people. And we've also got to think about in this scenario is even if this isn't tipping the location into a wholly or mainly looking after children, who else is in that registered residential home? Is that what's the age of the child that's going to go there, and what are the age and needs of the other people who are there? So if, for example, there might be one child and 5 adults in their 50s, we've got to take some of these examples or some of these scenarios on a case by case basis. But it's not impossible to place a child in a CQC registered home, but we would always urge you to think about those elements, and also then whether you're becoming a children's home by looking after wholly or mainly children. And then I'll just talk about that therapeutic residential care example. So the example is that we provide therapeutic residential care. When do we meet thresholds to be registered with CQC rather than Ofsted? So for therapeutic residential care, you would need to be registered with CQC if you were providing any of those regulated activities that I've spoken about. So again, go back to that scope of registration document with CQC. So you're thinking about who's providing, what the activity is that's being provided, and who is providing it. And then also, if you are providing that residential care wholly or mainly to children, then it's very likely that it becomes a children's home that is registered with that it should be registered with Ofsted, or it might be a scenario where you would be registered with Ofsted for care and accommodation, and you would register with CQC for regulated activity, more than likely TDDI.
And then the last example on this slide is about if there was a respite provision in a separate building but on the same site as a children's home, does it require separate registration? This is the sort of scenario I would really advise people to come forward and talk to us about. People now, I know, talk to regional colleagues if they've got any queries, but from towards the end of December, we'll be launching a registration helpline. So if people are looking to open arrangements that look a bit unusual, look a bit different, want to get some advice before they put their application in, then we're very happy to do so. And this is exactly the sort of scenario where that would be really helpful, because there is a little bit of an it depends here, and really understanding the statement of purpose, how that would operate in practice, how the site is set up. There are a number of questions and discussions we'd want to have with you to make sure that we arrived at the best possible solution for everybody. We're hoping that will launch on the 19th of December, But obviously, if there's queries before that, people can use the routes that they usually use into regional colleagues. So no easy answer on that one, Lucy. And I think people are probably realising this isn't all as straightforward as maybe we would all like it to be.
Yeah.
I mean, the next thing that we want to set out for you is really understanding what registration with each of us means in terms of what level of oversight, particularly for the commissioners on the line, that you would expect to have once you understand who somebody is registered with. So if a children's home's registered with Ofsted, we will inspect that setting at least once a year, depending on what the outcome of their inspection is. And we have a range of enforcement powers that we can use, obviously, if we need to, in a proportionate way, if there's anything that gives us concern. When somebody registers with us, if they register with us in the first half of the year, they're likely to get their inspection in the second half of the year. The regulatory year runs from April until March. And similarly, if they register with us in the latter half of the year, then the inspection is likely to be in the early part of the next year. The frequency of inspection of children's homes isn't determined by Ofsted. The minimum frequency is set out for us by government. We then take a proportionate approach around that, and clearly if we've got concerns, as you would expect, we would return more quickly. And, clearly if we make any compliance notices or take any action, then we would follow those up. All of the reports are published on our website, but we are required by law not to publish the address of the children's home. But for local authority commissioners, all local authorities have access to the full register of children's homes across the country, which tells you where they are, tells you about their most recent inspection, and also tells you if there's any enforcement action happening. Similarly, if we do take action, such as suspending a home or restricting the number of children that can live there, we don't do those things very often, but if we do inform all the local authorities in England and Wales, so that can inform your decision making. And where we are taking the most serious action, we will always have conversations with placing authorities about that. Lucy, I'll hand back to you for the CQC oversight.
Lisa, for the CQC bit. Thank you. So the first CQC scenario is a hospital that's registered with CQC. So CQC assess and inspect those healthcare services. They would either do that in response to risk or as a planned assessment. So that risk may be risk that's identified at a previous inspection. It might be risk that is organic and comes through CQC notifications about risk. I think this scenario is quite important to think about in the context of what we've described on this webinar, because, and I think there's been some questions as well about the children who are living in these sorts of settings that may be that people feel are more akin to a CQC registration rather than Ofsted registration. I think that the really, really important point to note in this one is that children would not go into a hospice or a hospital with a long-term plan to stay there. It is not their permanent address. They don't register with a local GP. They don't engage with those local services. If the same were to be true of a children's home, where they then that then becomes their home address. When children are admitted to these sorts of locations, so that hospital scenario, they are more than likely or should be admitted with a plan to discharge. So I think that sort of example is really important to pick out and think about the difference between those sorts of settings I've just described and a children's home. And I think there's been some questions as well about that. And then the other scenario that we've got is a care home that's registered with CQC that can accommodate children and adults. So that is the scenario that we use as an example before as of for home B, which is a scenario that does happen. So that's where a provider is registered with CQC as a residential care home and has children's either service user bans in our old language or special considerations in our new language that means that they can accommodate children and adults. So CQC will inspect those services and inspect the quality and safety of that care that's being provided to children alongside the adults there, but only if the children receiving regulated activity, CQC regulated activity at the time of the inspection. So that means that there's another potential gap if children are living in a CQC registered care home, because it's less likely that children would be in receipt of personal care as it's defined by the CQC regulations. And I'll hand over to you, Lisa, for the last example.
Yeah, so this is that example that we had earlier of a children's home that's registered with Ofsted, but there is some regulated activity with CQC happening there. That children's home would, again, as any children's home, would be inspected at least once a year against the full range of quality standards. But from the CQC perspective, CQC would assess and inspect the CQC regulated activity in the setting when they risk assess that that was the right thing to do. But if children weren't receiving regulated healthcare provision, then CQC wouldn't inspect. At the moment, we do occasionally, and Lucy, we have in the past done visits together, haven't we, where that was the right thing to do. So if there are particular issues or particular concerns, but at the moment we do not routinely jointly inspect at the same time because we are looking at very different things from very different perspectives with very different regulatory frameworks. At this point in time, we have no immediate plans to change that because it would require our government departments to change the regulatory frameworks that sit around both of our activities. But they are the sort of conversations that we continue to have. We do recognise that this is really complex and complicated.
Yeah.
So if we could just move on to, and I suppose that fits really neatly, really, with the sort of continued improvements. We have established a very collaborative approach between the two regulators and are in constant contact and conversation with each other about some of the complexities that we've shared with you today. So we have created a forum between us where we meet to talk about the complex models of care that we see. And when we see specific examples coming to either of our attention, looking at who do we think is the right regulator for this particular service in this particular circumstance. And then we can work collaboratively with you as providers to make sure that we get that right and get that right in a way that is sensible, pragmatic, etc. As I started to say before, we carry on working with DfE from an Ofsted's perspective to enable legislative change. We want to be more efficient in our ability to better protect children. It's great that we work so closely with the CQC, but we are also very mindful of the regulatory frameworks we both operate in do sort of clunk together a little bit in a way that wouldn't be ideal if you were starting from a blank sheet of paper. So we recognize and feel the same challenges as you do about making these things work, but I think, Lucy, we both feel we are working as closely together as we can do to iron out those things wherever we can. From a Ofsted point of view, people may be aware we published the Big Listen, which was followed a massive period of consultation about Ofsted and Ofsted's role. And as I mentioned earlier, we have committed to that pre-registration help service, and we expect that to be up and running before the end of the year. So slightly ahead of where we say on this slide, which is fabulous. And we are as I say, in constant contact with each other and government about where we think there are things that could be improved to help all of us get this right. Um, I know there's lots of questions about how long registration takes. From an Ofsted perspective, it does vary. It isn't as quick as we would probably like. We have, over the last few years, had more applications to be children's homes and then more recently supported accommodation than we could ever have predicted or ever have expected. The number of children's homes is at the highest it's ever been and almost double where it was not so long ago. Some of that's because homes are much smaller, some of that's because homes don't operate at full capacity, but we still have a large concentration of homes in certain parts of the country and less homes in other parts of the country. Some of the registration process isn't entirely dependent on Ofsted or what Ofsted can do. We, at the start, the legislation actually sets out what a complete application is, and our guidance hopefully gives everything people need in terms of checklists and step by step about what you need to submit. But we still sometimes find people don't get everything to us they need to. We will come back to you until we've got everything that we need. Then there are some parts of the process that are out of our hands. That might be around planning permission. It might be around the checks that we need to do with DBS. It might be around your references responding. It might be around the checks we do with local authorities. So some of those things are out of Ofsted's control. But once we've got everything that we need, then we endeavour to do things as quickly and as smartly as we can. Really hard to put a time frame on it because there are so many interdependencies along the way that impact on how long things are taking us. If we just move into our final thoughts then. Um, as I say, we're really aware that this is complex, and if people, I can see that in the chat there's lots of very specific questions that people trying to ask, which we probably haven't answered today, but hopefully have given you some principles to go back to and reflect on. How does this apply to me, rather than us having got to your specific? But ultimately I think we all want the same thing, don't we? We want children to be in the right place, in the right setting, with the right oversight, where they are safe and they're getting the care, support and attention that they need, be that for their healthcare needs or be that for their wider needs. Providers, it's your responsibility to ensure you get registered correctly and take advice if you're not sure. And for commissioners, hopefully this has been helpful for you to understand the difference between the types of services and settings and what that means in terms of the oversight that then happens. I know I mentioned earlier that all commissioners have, all local authorities have access to the list and register of children's home. We have a nominated number of people in each local authority, and that's who have access to that information. So there will be people in your local authority who can access that. And if you need more people to access that, then you need to come back to us. But ultimately, if you're not sure which regulator you need to register with, talk to us. And there's a good chance we'll then talk together if it's not clear, or we need to advise you together on what the best possible outcome is. Lucy, is there anything further that you would like to add?
No, I don't think so, Lisa. No, just to reiterate, that we know that it's complex, and I think from our starting point, when we had reflected on the guidance that was available previously, we had thought that that didn't help to unpick some of those complex issues. So we hope that our updated guidance is more helpful, but we also acknowledge that it's not an easy set of circumstances to think about and to work your way through. But we will, I suppose, in part of us even doing this webinar and having these conversations is to make people aware that we know it's a really complex issue, but that we want to get it right, and we want to be able to work with people to get it right, to make sure that there's the right regulatory oversight and safeguards in place for children and young people. So we would just really urge you to come forward and have those conversations. There are processes both at CQC an Ofsted where you can have those conversations if once you've looked at the guidance that's available that it's still not clear. But yeah, nothing else I don't think from me to add, Lisa. Thanks.
Now, as I say, the slides will be available to people. Also, at the end of this slide pack, there is a list of resources from both Ofsted and CQC that we think you will find helpful. There are some key reference documents that hopefully will help you to navigate some of this complex area. Can I just check in with our colleagues if there's anything that we need to pick up on? And we
Yes,
will come.
hi Lisa, it's Simon. Um, Understandably, as you can imagine, we've had a lot of questions in the chat today. A lot of them quite specific around particular things. I think there are some themes that are coming through, and I think they're things that you have both answered. There were just a couple of things that I thought it might be helpful for us to just reiterate. The first thing is around kind of um, understanding what constitutes personal care. And Lucy, I know you've referred to the scope document, which is in the links, but I think there's a
Yeah.
lot of questions about actually understanding what actually constitutes personal care, and that being the trigger for registration with the Care Quality Commission. So I don't know if there's anything else you want to add about that.
Yeah, I think I suppose it is. I would point people to that scope of registration document because that describes personal care in its entirety. And I would also urge people to almost kind of read those words that go in between that description. So when it's looking at prompting, so for example, when it's talking in that personal care definition about prompting and supervision, they're not things then that can happen independently of one another in order for it to be defined as personal care. I think that that's probably the best starting point for people, Simon, and then go through our kind of registration conversations if you've got any other questions. If So when we get into a space where we are looking at, when we work through those different scenarios and you're thinking about care in an Ofsted registered children's home, that's then where we definitely wouldn't register the regulated activity of personal care, because that's when we get into a space of duly registering and regulating, which is, one, we're not allowed to do it, and two, it's not helpful and doesn't add value to children. So I think it is really complex. I would urge people to go back to that registration, to CQC scope of registration guidance, and look through that full definition, and think about what it is that's being provided, and whether you think then that is falling into scope of personal care, and look at our joint guidance. But and if there's any more questions then after that, then to contact either Ofsted or CQC, depending on whether you're thinking that it's a children's home or regulated activity that would need to be registered with CQC.
Okay, thanks. One of the other themes that seems to come through in the questions is around the sort of difference between supported accommodation and supported living, and kind of the sort of differences in those two. And I think, which, as we know, there's quite a nuance around that. But I think if we could just clarify, kind of the supported accommodation is regulated by Ofsted, and not the Care Quality Commission. And it's around 16, 17-year-olds with low support needs. So I don't know whether, Lisa, you want to say a little bit more about that.
So if those 16 and 17-year-olds with low support needs are children in care or care leavers, then that service needs to be registered with Ofsted. If those 16 and 17-year-old children are placed there as a child in need because they were children who were homeless, then that service does not need to be registered with Ofsted if those children are just receiving support. That is a gap. That was a decision taken by government when they defined the scope of what was supported accommodation and what would be regulated.
And then if you add on to that, thinking about CQC and supported living, that group of children, Lisa, wouldn't necessarily be, because supported living in itself is not a regulated activity, there isn't an easy, the supported living and supported accommodation are not a kind of transition arrangement from supported living to supported accommodation. They're two completely different things for two completely different groups of people. So I think that's probably important to reiterate, and that CQC might sometimes regulate a regulated activity in a supported living setting.
Simon, I can just see there's people asking questions about if something's registered with Ofsted and CQC, can the registered manager be the same for each? I think what we're trying to describe is it's the children's home will be registered with Ofsted with the registered manager. The only activity at that children's home that would need registering with CQC would be regulated activity, Lucy. It's not the
Yeah,
home that becomes registered with a
no,
registered manager.
no,
I can see
no,
there's a few
it's just the
questions along
regulated
that
activity.
that sort of
Yeah,
that sort of line. I've also spotted something about the list of children's homes, and can that be shared with people other than local authorities? Ofsted's restricted on who we can share that information with in law, and in law we're only allowed to share that information with the DFE, with the Office of the Children's Commissioner, with local authorities, and we can share extracts of it with the police. We don't have any legal mandate to share that information with health professionals, but the local authority may choose to do that to enable better working relationships locally. It's just Ofsted aren't legally able to. Sorry, I just
We
spotted
had,
those ones, Simon, that I
no,
could answer
that's
quickly.
fine.
I can't read all of them, but there was a few I could
We
see.
had quite a lot of questions about short-term services and respite and kind of how they fit into the regulatory framework. And I think the kind of question is really, it relates probably, Lucy, back to what we were saying before about the activity and whether it's regulated activity that the children are receiving.
yeah. So if it was in a hospital setting, then then hospitals generally are registered with CQC. But like I said earlier, the children when they go into those settings would be admitted with a discharge plan, not to be admitted there to be for it to be their home.
But also noting many short break services do fall under the definition of a children's home. So when we think about children's homes at Ofsted, there are four broad categories. There are residential special schools that are registered as children's homes because children stay there for more than 295 days. Again, this is set out in law. This isn't an Ofsted rule or policy. There are secure children's homes, there are children's homes, and then there are short break services that are registered as children's homes. And that would be a building that is open constantly or regularly open for children to go and have care and accommodation there. That does become regulated as a children's home, and we have many of those.
Lots of questions are on very similar themes, which I think you've actually covered in this. It may be worth uh, going to the list of resources at the end and just pointing colleagues to those resources. So several different documents there that we've referenced in today's webinar, including the revised joint registration guidance, which is what this webinar is based on, but will hopefully feed into some of those queries that people have asked.
I can see somebody's asked a follow-on question to the registered manager question, Lucy. So I think maybe if we do just pick that up, because what they're asking is if you register regulated activity with CQC, that you need a registered manager to manage that regulated activity.
If it's at a location, So if the location is registered, then you would need a registered manager to register that, to be responsible for that activity. But again, I would just point people back to the scope of registration document from CQC, because that's got everything. I know it's a big document, and if we were doing a webinar just on that document alone, we would we would be here for several hours. But I point people back to that scope of registration document, and I guess that part of the challenge and part of the complexity as well is being able in those scenarios where you are needing to fulfill requirements for both regulators, that can be fulfilled. Whether that's the same person is would be explored at the point of that registration, as in terms of like capacity and
Yeah. And I can see there's quite a number of questions on size. There is no prescribed size for children's homes. They have tended to become smaller over recent years, but there is nothing in law or policy that says children's homes have to be a certain size. For supported accommodation providers, because we register at service level, the registered service manager can then be responsible for a whole range of premises. There is, there's only sensible limits on that in terms of what is humanly possible for somebody. But for supported accommodation, we expect a registered service manager that's overseeing a very, very large service may have a management structure that sits under them to enable them to do that. And we have lots of short break services that are registered with Ofsted, where they don't have regulated activity registered with CQC, but we do have some that do, Lucy, don't we?
Yeah.
So that seems to be a reoccurring theme in the side.
Yeah.
Anything else, Simon, or do we think we've covered the
I,
sort of
I
main
think
biggest?
I think we have covered the main themes. There's lots of questions, but they're all on those very similar. Lots of questions about kind of what constitutes personal care or TDDI, which I know is a really complicated thing to actually answer, Lucy. And as you've already said, the scope of registration is the best place to start in trying to understand that.
There's just one question I want to pick up because somebody's just misunderstood something. In terms of what I said about supported accommodation, I wasn't saying that supported accommodation where children don't need care doesn't need to be registered with Ofsted. Supported accommodation for children in care and care leavers who require support must be registered with Ofsted. There are some children who are 16 and 17-year-old who will have been placed as children in need, not as children in care, into living arrangements because they were homeless. Those services do not need to be registered with Ofsted. Sorry, Simon, that just felt like a really important point for people to go away with a muddled thought. So, okay. Colleagues, we're going to draw to a close. We will go back through all of the questions and we will see if there is anything that we want to update in our guidance in light of those, if there are any things that we think we could helpfully clarify for you. That list of documents at the end hopefully should direct people to where they can get the help that they need. I'm sure providers know their routes into Ofsted and their routes into CQC respectively. For commissioners, your best route in is through your regional senior HMI from an Ofsted perspective. If you've got questions that you want to ask, they will be your best port of contact. And just to clarify, the registration helpline that's going to go live is an Ofsted registration helpline, but obviously any queries that come that way that need to be shared with CQC or need a joint look or review, we will do that appropriately, but it's an Ofsted-led project and won't be able to answer CQC specific queries. We'll just pass those to Lucy and colleagues. Yeah. But thank you for joining us. Much appreciate your time. We understand it's complicated, but we hope we've done something that will at least help you to have a grasp of some of the principles that might help you navigate through. Thank you.
Thanks, everyone.